From morning sickness, food cravings to waking up in the middle of the night, changing nappies, babysitting and breastfeeding, none are the most exciting things to do and is certainly not what a teenager dreams about.
I was with my boyfriend for 2 years and then we was using condoms but he split, but I didn't think that I would need to get the morning after pill. And then I found out I was pregnant. It was just a big shock to both of us because we were so young. And then I told my parents and they wasn't really speaking to me for a while. And then we got back on good terms, like when I had my scans and that, she came to my scan.
Some loved the whole experience, while some others, like Fiona, her pregnancy at the age of 18 took a toll on her relationship with her family.
When I found out I was pregnant, I was more scared to tell my mum. I sat there crying. I told my mum. And she was happy, disappointed in me for not getting further in life, but happy that she was having a grandchild. My dad was more disappointed. I hadn't spoken to him about it since.
The figures show that there has been just 137 fewer pregnancies a year since 1998 in Birmingham. Despite drops in the numbers, we can't celebrate triumph as England still tops in teenage pregnancies in the whole of Europe. What are the reasons behind these huge number of young pregnancies? We asked Denise Smith, a support officer for Birmingham-based Charity House for Teenage Mums.
I've been here 23 years and I think the reasons haven't changed very much in that time. There's still a lot of breakdown of family relationships, so that's a big factor. A lot of young people come through the care system from social services, so they get pregnant and obviously then they're homeless. And so I think those are sort of the two main factors really. The family breakups, young people, a lot of step parents don't feel they fit in anymore. Obviously there are some cases of abuse where, it's not safe for young people to live at home. And from time to time we do have some girls, from the Asian community as well, who obviously need a place of safety, when they get pregnant.
As a charity, what sort of a contribution do you think you are making in controlling or coping with this teenage pregnancy?
We try to prepare them for independent living, so we try to give them the skills that they'll need to live out there with their child. We'll help them into education and training if that's the route that they want to take. And obviously we give them contraceptive advice and advice on, sexually transmitted diseases. So hopefully, by doing that, we're actually trying to reduce the numbers of further pregnancies.
Mrs. Perry, another support worker from Prior House for Teenage Mums in Birmingham, reckons the problem is beyond the lack of sex education.
I think they're very knowledgeable about sex education because we do questionnaires with them. So we know their level of knowledge about sex education, and it is quite knowledgeable. We find they're very, very lazy about getting the family planning sorted out. Young women are having sex at a younger age, so they do need to go and make sure they're covered. But they all tell me that they don't like using condoms. Well, the boyfriends don't. So it's down to taking the pill, which they always forget. So that's not working. We would try and encourage them to have the implant, which will cover them for 3 years. But that's not addressing the sexual health of the young women if they have numerous partners.
4,716 teenage girls got pregnant in 2008 in West Midlands alone, making it one of the top 3 regions in England with the highest number of teenage pregnancies. The current conception rate of West Midlands is 44.6% as against the national rate of 41.7%. A national campaigning organisation called United Kingdom Youth Parliament, run by Young People for Youngsters of England in collaboration with Birmingham City Council, has come up with a report on teenage pregnancies in West Midlands. Tyrone Falls, a former MP of UKYP, tells us more about the report.
The report was all about making it aware to government that it's about showing that the government, that young people really do care about their education, and that means relationships and sexual education.
What were the recommendations?
The recommendations were basically what we'd come up with were SRE could be entitled for all children and young people as part of the statutory provision of PSHE in all schools. No school should be able to opt out of delivering good SRE to their pupils. It includes primary schools, faith schools and academics. Another one was schools should employ more trained staff and specialists, personnel to teach SRE. Relationships should be taught as part of SRE to emphasise more on the relationship side of it instead of the sex side of things. The implications of teenage pregnancy should be taught at to all students. To explain, there is if you're a girl, obviously, if you're pregnant, then there is implications sometimes with teenage pregnancy.
The Birmingham City Council has promised to implement on the agreed recommendations by UKYP by May 2010. While everyone is making an effort to make things better, the teenage mums themselves have their own messages to give.
To be fair, before I was pregnant, I didn't know how hard it would be until I had my daughter Kalia, and now that I've had a child, it's sort of not put me off children, but made me want to wait at least 3 years now till I have another child.
While Clivius speaks about the hardship it is to be a teenage mum, 17-year-old mum Mariah just wants to move on with her life.
I believe that things happen for a reason, so therefore I've had a baby, I'm going to move on now. I'm going to put all that behind me, try and get on with my life.